it's Ashley from Demystifying Your Health. Welcome! Today we're going to be talking about doctor's visit. You've just come from the doctor's and you have more questions than when you went in. You didn't understand half of what was said, and you don't know what you're supposed to do before your next appointment. Unfortunately, this is not an uncommon experience. So how do you make the most of a doctor's visit? The first step of any doctor's office visit is sort of like an interview process. Your doctor is going to be asking you a bunch of questions, and you're going to want to share specific information about your current health status and your past medical history. Both of these are important as far as directing your care. There are certain things you're going to want to share with your doctor. This can include your allergies and the reactions. Some people have nausea and vomiting. Other people have itchiness or hives, and some people have anaphylaxis where they stop breathing. Your doctor is going to need to know these because if he or she wants to give you any prescription, they're going to want to make sure that they don't give you any medications that are similar to the ones you're allergic to. The next thing is medications. They're going to need to know the name, dose, and frequency. This is important because if they need to adjust something, then they know where you're starting from. They also will need to know your chronic conditions, such as, do you have diabetes? Do you have high blood pressure? This way they can judge if it's being managed well or if they need to tweak things a little bit. They will also need to know about previous surgeries. What type of procedures have you had done? Have you had certain body parts removed, like your appendix or your tonsils? That way, if you're coming in with a medical complaint of some kind, they'll already know, okay, they don't have their tonsils, so it can't be that. Or that helps eliminate certain things or can pinpoint clues to certain other illnesses. They're going to want to know what your previous blood pressures were. That way they know if it's getting better, getting worse, staying the same. Same thing with recent lab work. If you've had blood tests done recently, make sure that the doctor's office receives a copy before you go, or bring one with you. They'll review it and make sure that everything's within normal limits, and if not, they will help you find a plan to fix them. It's also true with any other testing. If you've had any x-rays or CAT scans or anything like that, make sure to bring a copy with you. If you see any specialists for any other conditions that, like diabetes, there's a specific doctor you would go to, or a cardiologist if you have any heart issues. Make sure that your primary care doctor has the specialist information so that way they can reach out to them if they need further information than you're able to provide. Same thing if you visit any specialist, make sure that they know who your primary care doctor is. And the last thing is emergency contact information. It's important to have this on there so that way if your doctor needs it, they have it available. And the nice thing is if you have this on a single sheet of paper, you can bring it with you not only to your doctor's office, but if you end up in the emergency room, this is key because it has everything on there that they're going to need to know to be able to treat you successfully. Sometimes it can even look like this sheet right here. You can type it up on your computer and bring it with you and print off a copy. After you go over all of your health information with the doctor, they're going to give you instructions on what they want you to do next. This is usually where communication sort of breaks down. Doctors have the tendency to use medical terminology, and patients are often afraid to ask questions or seek clarification if they don't understand something because they don't want to question the doctor. However, this is the single most important thing that you can do in a doctor's visit is to ask questions if you don't understand something. Because if you don't understand it, you're not going to know what you need to do. And this can obviously impact if you get better or if you get worse. There are some things that you can do to help you remember what your doctor tells you. One is to ask for written material. Often your doctor will have stuff that they can print out or brochures, something that you can take home and review after the appointment. You can also ask to record the appointment on your phone or an iPad or something like that. This way you can replay it at your convenience and take notes from it. You can also take notes during the visit or bring a family member or friend to do that for you. This way you'll have them to review later. Another important thing to remember is if you have any questions, write them down beforehand if you can, listing the most important ones first. This way the doctor will be able to answer those and address the ones that you're most concerned about. If for some reason your doctor can't answer all of your questions because you've run out of your allotted appointment time, ask to speak to the nurse practitioner, the physician assistant, or the nurse. Most likely they'll be able to answer your questions, and this way you're not going home with unanswered ones. After a doctor's appointment, it's important to follow up. If they ordered tests like blood work or x-rays or anything like that, if you haven't heard in about 3 to 5 days, give them a call to get your test results. It's also important to follow up if you can't remember the instructions they gave you, so definitely give them a call if that's the case. If they prescribe any new medications, keep track of any symptoms. Were the symptoms that you are having, are they getting better? Are you having new symptoms, or are the symptoms getting worse? And follow up with your doctor in your next appointment about all of these. If you have any medications that you have a reaction to, whether they're new or old, call your doctor to see what the next step should be. Don't just stop them. If you have an allergic reaction to the point where you're having hives, trouble breathing, anything like that, then you need to go to the emergency room. But for anything else, then give your doctor a call and they will advise you on the next steps. If you went to the doctor because you were sick, give it about 2 to 3 days of following their instructions to see how you're feeling. If you're not getting any better, give them a call back and explain what your symptoms are and you've been following their recommendations. What else should you be doing? And they will guide you from there. With a little preparation and taking the time to get any questions clarified, you'll be able to make the most of your doctor's visits and make informed health decisions. Stay healthy.